So, today I had a turbinate reduction on my nose. I have been dealing with this for about a little over 8 months. I have severe allergies. I've seen about 5 different doctors. Um, One, a sleep study doctor who determined why I was having trouble sleeping. Um, I seen a neurologist to figure out another reason why I wasn't sleeping. And he pinpointed that I had some respiratory issues. I then went to an ENT specialist who couldn't do anything for me besides refer me to a surgeon because my nose was so enlarged. And if you don't know what a turbinate is in your nose, it basically helps the airway in your nose. And when you are sick, they get enlarged and then they go back down. Unfortunately, I went to an allergy specialist and I'm pretty much allergic to all grass. And I'm allergic to my dog, I'm allergic to cats, I'm allergic to household dust, which basically means that in late fall, around August, September, I get really, really bad allergies. So, with that being said, I had to buy a air purifier to purify my air and keep it moist. And I then ended up getting a very bad sinus withdrawal because the antihistamine blocker, which I was taking, was Zyrtec and Flonase, and eventually it gets to a point where it does no longer work. So I then had to stop taking it before having surgery because it wasn't doing anything anymore. So the surgeon was pretty booked. I had about a month or so wait before I got in, but I complained constantly and consistently, and they pushed my appointment up because I got to the point where I was sleeping on about 3 to 4 pillows a night, which then left my neck aching, my shoulders aching, and my back aching. So I then got in earlier, a lot sooner. I wasn't actually supposed to get in until April, um, which I got in today, March 11th of 2016. Got in and I had went to see the doctor first, and we did a visit where he looked down my nose with a camera, and then we did more allergy testing, and then we did a follow-up, and he suggested, you could, I had already did my research on turbinate reduction and sinus surgery, just so I can go with a clear mind of what I possibly could be having and how it's affecting my sleeping, my breathing, and things of that nature. And he said, you can go on an allergy shot or drops. It would take 3 to 5 years to do anything for you because your nose is so enlarged. And I was just like, wow, how big or enlarged is my nose? Because I can't see it. Um, and he's like, yeah, I could tell, there's discomfort. I can tell, you sound congested. I was using my inhaler because I have asthma. I was using that more frequently. I was always tired because at night I couldn't sleep. I could hear water gushing, which is post nasal drip, in the back of my mouth and my throat at night. And it felt like I had sleep apnea, and that's why we did the sleep study, which ended up being this turbinate issue being a respiratory issue. They did want to take out my tonsils, but I'm older So they don't do that unless you have sleep apnea, and it's very a chronic case of sleep apnea. The first sleep doctor did diagnose me with chronic insomnia, but not really trying to find out what the underlying issue was of causing me to not sleep and have chronic insomnia. Which I think in that case you have to be really persistent with these doctors because they all do one particular job and they don't really consult other doctors that often or refer you to another doctor. So you have to do all the footwork yourself. If you believe that you're having this issue, definitely, um, you know, be persistent with your PCP doctor. Be persistent with any specialist you're referred to. Request for um, a referral to a specialist if you believe that, it's allergy related or respiratory related. Because that's what I did. And, after almost like a year of not sleeping good, I think we've pretty much pinpointed everything. Um, so, with that said, I went in and I had the surgery. Um, I was like, I'm not going to do the allergy shot 3 to 5 years and still not see a difference. And what happens is you have to go every week to get the allergy shots, and it's not guaranteed to work once you've gotten to this point. Um, so we agreed on the surgery, booked the surgery, went in today. Surgery was very quick, it was about 45 minutes. Went in, got my IV, as you can see. I had um, my bands and everything on, and I went and started the anesthesia and everything, and it just went quick. So now I'm home. I have this thing on my nose. I'm not sure if he packed it. Um, Sometimes they pack it after surgery just to keep everything straight and good. I'm pretty sure they did. Um, and I feel great. I feel better already. I have to take my pain medicine, which is oxycodone, um, at 10. I'm going to take it on time so I don't feel any pain or anything. It's been just like bleeding, oozing. I've been using a saline solution to clean it out. Use that 4 times a day. Take the pain medicine every 6 hours. Um, and tomorrow I'll just do basic Tylenol. But you definitely need a bunch of these because there is a lot of blood that starts to come um, from this turbinate reduction, which is basically almost like lasering off some things in your nose, kind of removing it and shrinking it down. And in here, I can see that this has a little scar there, but I can see how this is so much more thinner. Um, I'm gonna be like a little bit bruised and puffy and swollen because it was surgery. But I feel 100% better. I can definitely breathe and keep my mouth closed and breathe. It is a little difficult, obviously, because this is on, but I definitely see a difference. I definitely notice a difference. I feel better already. I have a follow up in 2.5 weeks. I cannot blow my nose for 2 weeks, and I cannot. And when I sneeze and cough, I need to keep my mouth open. And I notice when I do that, all the blood gushes out. Um, so I just been changing this pretty much every half hour or so, and it has finally started to kind of shut down. So and stop. But I'm happy that I watched other YouTubers talk about their surgery. I'm happy that I got it done. I'm happy that I stayed persistent with all 5 of my doctors that I seen. That I kept it persistent with myself and knowing my own body and knowing that this was really affecting my sleep pattern and makes you moody, cranky. It just takes over your whole world. I mean, I couldn't exercise. I can't really go for long walks. There's a lot of things. I haven't worked. There's just a lot of things that it affects, and no one really understands it unless this is going on with them. But I say if this is something that is occurring with you, go for it because this was like the best thing that I've done. And I said I just got it done today, but do I see a difference? Absolutely. I don't know if or how much it's really bleeding. It's gotten to the point where it's not really bleeding that much. But as you can see, inside our nostril. So, and there you have it. It is a turbinate production. And I will tune in a couple days.